So, good morning, everyone. In another week of the food safety course, Shiraka 2025. Today we are going to finalize the TTX risk assessment exercise. We're going to discuss the answers to the quiz. I'm going to explain a little bit more about the Netherlands official controls with regards to how this Bureau of Risk Assessment is organized, the multi-annual national control plans, which are required by the European Union, the supply chain studies done by the Dutch Food Safety Authority as a foundation for risk-based controls. And I'm going to answer a few questions that have been raised in the Padlet regarding the official controls in the Netherlands, see if I can help clarify. And I'm going to prepare for Thursday, where we're going to start on the HACCP exercise. So we need to talk about official controls in the Netherlands with regards to food business operations. So let's go ahead and let me share you my screen. So first, let's go to the results of the test, the TTX case in the Netherlands. We ask you to answer two questions. One was about the limit of what the Dutch Food Safety Authority has set on TTX in muscle meat. And the question is why did they set it at 25 microgram per gram of muscle meat? And the correct answer was because that was the lowest possible limit of detection at that time. And the second question was in reference to some of the statements that farmers made in the newspaper article. They said the standards for this substance are 100 times higher than in Japan and 20 times higher than in the rest of Europe. And somebody said we have a zero tolerance policy. So the question is, why did they say that like that, particularly the zero tolerance policy? Was it true? And do you think it's fair to say that the Netherlands effectively had or has a zero tolerance policy? That was a bit of a tricky question because there were two yes answers, or you could answer them. All of them were correct. But the main reason, the most important reason was that, as explained by Dr. Syme in his presentation, that the adverse effect level is lower than the detection limit. So the precautionary principle applies. We could not set another limit that gave a fair link between the exposure and the adverse effect. So because the level actually is lower than what we could detect, you have to set this detection limit as the lowest, following the precautionary principle. So because of that principle, the Bureau had to advise to take the detection limit as the lowest limit possible. If this adverse effect level was higher than the detection limit, they could have made an estimate of what would be acceptable as adverse effect, and that would have been then the limit for rejection or a warning limit. But because that adverse effect level was so low based on studies, they could not do anything else than take the detection limit as the acceptable limit. So in principle, that was, as a result, that is a kind of zero tolerance policy. Just a second. All right, then if there are no further questions on the TTX case, I would like to hear from you whether that case was useful for you to get a better understanding on how risk assessment works in reality. Can anybody reflect on it? Was it a useful exercise? Yes or no? Well, I guess that's probably a too difficult question to exercise early in the morning. Hi, Vassan.
Good morning.
Please go ahead.
So actually, yes, it was very useful, especially with the real incident, okay, with the real case. So in that case, in that scenario, especially after we see the precaution, also the benefit of it, okay. So it's not only 1 year incident. It's not one time, okay. So we see the development of the precaution. We see how improvement have been done. We see also the improvement of the people, okay, or the farmers themselves, okay, from the beginning, how they refuse, and after that, how they accept it and start to make other precaution, etc. So it really was useful, and it's like a history, okay? So thank you very much for the example.
Okay, thanks, Vassan. Great to hear, and happy to hear that that has been the learning effects for you. Yeah, it's as you really summarize it very well. I think this case explains how the competent authority had to respond over time. At the beginning, where there was no acceptable limit, but there was concern about exposure to people. And then over the years, after they've done their studies, they have been able to set a fairer limit. And indeed, the industry also gained support for that. And they've been actually very well able to explain what was happening. And the effect in the end of exceedances is now very limited in terms of business consequences. Yeah. Okay, Bassam, please go ahead.
صباح الخير للجميع. يعني أنا ما بدي أكرر اللي تفضلت فيه وسام، لكن بشكل عام المثال كان واقعي، يعني من خلال الممارسة على أرض الواقع احنا شفنا تجربة حقيقية على أرض الواقع. حددنا نقاط القوة اللي هي في وجود نظام مراقبة واستجابة سريعة من السلطات. نقاط الضعف إنه كان في شوية غياب معرفة دقيقة بمصدر السم أو ضعف الاتصالات بين المستهلكين. وكان في فرص لتحسين برامج البحث، وحتى تم الحديث عن تعزيز ثقة المستهلكين بالشفافية، واللي تعلمناه بالسوت من خلال الخسائر الاقتصادية هاي اللي كانت تهدد المنتج، والتراجع في الطلب والآثار اللي بتأثر على هذا الموجود. فهي كان مثال رائع من خلال إنه نتعلم من تجربة حقيقية حدثت على أرض الواقع. كانت ممتعة، ويعني بتخلينا نتعلم من خلال الممارسة شيء مش بس في القراءة، لا، شيء حدث على أرض الواقع، ونستفيد منه في تطبيقه على كل الأمثلة اللي بتمر معنا في المستقبل. شكرا لك.
Thanks, Bassam. Thanks. Abir?
Okay. Something's going wrong with the internet today. So if I left and came so many times, I don't know what's happening here.
Okay.
This is first. For me, yes, it was a good experience, especially to see that farmers all over the world act the same. There's no difference, even the culture difference, but their reaction to services is the same. They all have the same attitude. So this shows you that this is a point that should be dealt the farmers awareness or collaboration with the farmers, etc., in order to reach the goal. This was for me very interesting.
Okay, thanks, Abir. Good to hear. Yes, indeed, and in terms of how every stakeholder in the chain, they feel responsible for only the part that they are contributing to, and that's fair enough. Only the government has to take care of almost every stakeholder because of economic aspects, fair trade, but also public health. So the most challenging part, I think, still is the government to deal with all these interests, but also to design and come up with plans and rules that can be followed and adhered to by the industry and other stakeholders. Otherwise, it will not be a realistic control effort. Okay, thanks a lot for your reflections. Then let's now touch upon a few elements that you may have seen already when you have looked at the presentation of Mr. Syme in doing the exercises. But I think some topics require some more explanation and might help also to understand what the how risk-based official controls look like in reality in the Netherlands and in the EU. So on his presentation on risk assessment and preparation for crisis management, which you can find in Talent LMS, once again about how it is organized. Most important, about the numbers of inspections, number of staffing. This is from 2019. I want to share with you some more up-to-date information. And for that, I would like to show you some bits of the multi-annual national control plan. This is in Dutch, however, and it gives you figures and also priorities on different aspects of the official controls in terms of food safety, feed, animal health, plant health, etc. If we look at the staffing currently of the competent authority and some of the organizations that also perform official controls, you'll see here the Dutch Competent Food Safety Authority, the NVWA, and this COKZ, the Controlling Institute for Dairy and Eggs. And then you see the numbers of people involved in these organizations. So bear in mind that the Dutch Food Safety Authority controls food, household appliances, animal welfare, plant health, but also like illegal fisheries, illegal farming, and other illegal practices. So with this number of people, they have to control a industry that covers a large part of the country, tens of thousands of food business operators, from primary industry to manufacturing to retail. I don't know if these numbers reflect anything, or if you can compare it with your own organizations. I would say if you look at all the activities, including laboratory facilities, etc. Oh, these are not included actually, because it's part of another organization. So this is just supervision, inspection, auditing, import-export controls, certification, etc. And and the other one, SCAL, which is for inspections on organic production. They also cater for like 140 people. While we are looking at the multi-annual national control plan anyway, I said it also says something about priorities. Strategic targets. And perhaps this is interesting to read. Of course, the official controls need to cover everything which relates to the general food law and the other legislation related to food safety. But what the Dutch Food Safety Authority is going to focus on, or it is focusing on for now in the next few years, is to increase the responsibility or the awareness of responsibility in the industry for food safety. So that's still a very hot topic. Even the modern law has been introduced already 20, 30 years ago. And in signaling assessment and control of emerging risks, and to reduce the level of fraud and deception in the food chain, and to improve trust in the system, in the control system as a whole. Fairly abstract still, but what it means is that the existing risks like water quality, basic contamination of feed, food, and in raw materials and in the manufacturing process is pretty well under control. So now the focus is on emerging risks like this TTX, because that may pose new risks to the community. And fraud and deception is as actual as ever. I would say if you would compare it with other countries, the level of fraud is pretty limited, but we had very serious cases, incidences, like in the past when horse meat was traded for bovine meat. There was no food safety risk found in that case. But of course, if a company cannot or does not show the evidence where the material is coming from or the identity of the food, then the checks are not in place. So that gave a huge concern on the traceability and identification of food lots. And fraud and deception is still taking place. But the impact, I could say, is on food safety is pretty limited. But yeah, if people want to gain and keep trust in the modern food safety system, you have to address those issues definitely. How is the Dutch Food Safety Authority doing that or trying to do that? They emphasize on self-control by the companies. So if they're going to inspect or analyze results of performance, then they're looking at how companies doing their self-controls, what the results are, rather than taking samples, rather than doing inspections themselves. So perhaps on a sector level, they will collate information indicating the level of compliance because of that self-control. Ibrahim, go ahead.
صباح الخير. السؤال في حال ثبوت الغش في هولندا، العقوبات كيف بتكون يعني على الشركات؟
Yep. That's a very good question. There is, and I need to check for that. I will do that in a minute. There's a very clear sanction policy by the Dutch Food Safety Authority, which is grounded in the general sanction policies of the Ministry of Internal Affairs, which has different stages. So minor non-conformity is a warning, repeated minor non-conformity is a fine, a major non-conformity is a fine, a repeated major non-conformity is closure of the company, and if it deals with fraud, for example, then the power to seize profits through the judicial system is also an option. So there have been cases that companies who have committed fraud at a very high level, owners have been sentenced to jail, but also companies, they had to pay a fine generally as a percentage of their turnover, or if there was a clear financial impact, then the fine was based on that. I can try to find that policy. I know for sure it's in Dutch somewhere. We also used it in other courses. It's very useful to look at it how they categorize the different levels of non-compliance and what it actually means in terms of financial consequences. So that helped to avoid a lot of confusion between and discussion between the competent authority and the food business operators, but also it helped to avoid a lot of court cases dragging along with several sessions. So it has also helped to make the enforcement more efficient. I will get back to that. Thanks for that question. So this is in very broad terms what the policies are. Okay, Madi, go ahead.
صباح الخير للجميع. أردت أن أسأل لأنه المكملات الغذائية في معناتها في مجال رقابة السلامة الصحية للأغذية في هولندا، معناتها هي من مشمولات السلامة الصحية للأغذية، أما أنها تخضع لضوابط أخرى من خلال المراقبة الصيدلانية أو غير ذلك؟ هذا سؤال. شكرا.
Yeah, it's the companies that are responsible for applying those additives in the correct way, either whether they use legal stuff, chemicals, or in the right concentration. It's monitored by taking market samples based on risks. So if the department in the Food Safety Authority that is looking at emerging risks or finds signals that there is a higher level of use of certain additives in the food industry, then they will target their inspections to that. They will increase sampling. And if they find non-compliances, they will follow it up. So it's a responsibility. The monitoring is responsibility of the competent authority. Compliance with the law is the responsibility of the company. And therefore, there's also this enforcement plan, which tells you clearly what the consequences of not of using illegal substances. Does that answer your question?
أنا سألت على المكملات الغذائية وليس المضافات الغذائية. المكملات الغذائية التي معناتها تباع في الصيدليات، وهل تخضع معناتها على الرقابة معناتها السلامة الغذائية، أم معناتها لديها طرق أخرى للرقابة؟ المكملات الغذائية، ليس المضافات الغذائية. وشكرا.
Okay. Yeah. So if you talk about pharmacies, you mean for human intake, right?
Excuse me, he's asking for supplements, not additive, not food additive.
Okay. So food supplements, yes, that's a very hot topic because it's very easy to start a business selling food supplements. You can just set up a website, make a contract with a company who provides the ingredients, contract with another company who puts the ingredients together in consumer packages and labeling it. That's happening a lot, and it's also it has raised attention at the Dutch Food Safety Authority, particularly the sales through the internet. So there's a separate group that is focusing on that. And there are pretty strict rules on selling supplements. In many cases, it's not a matter that the ingredients are unsafe, but in most cases, it's about health claims. that are not supported, and that's fraud. So if they find companies selling these products claiming it contributes to certain the cure of certain diseases, which cannot be supported by evidence, then they will get a huge fine on that. But yeah, it's not an easy way, because these companies start like, yeah, they grow pretty quickly in numbers, and it's easy to start a business like that. Particularly because if you start a food business in the Netherlands, the only thing you have to do is to register your company, but you don't get an initial check by the competent authority whether your establishment is adequate, whether the products that you sell are safe. That's not how it works in the Netherlands. The food safety authority decides by themselves when and how they're going to inspect food business operators. So not when you enter the business. But it has a high priority indeed, the food supplements, but mainly because of health claims, not so much about adding illegal substances to it, substances that may cause harm. Thank you. Abir?
Okay, so what I conclude from all this discussion is that, and it's very obvious, once you're talking about food safety, it means the whole involved, the government, stakeholders, etc. If you have a gap in certain place, this won't work.
Yep.
Yeah, and it's a complete cycle, if you can see, and it's very important to involve the smallest stakeholder within this process. Otherwise, you will have a gap.
Yeah, and the gap will so therefore this traceability requires if you fail to prove which, I hope my computer is still working. Yeah. If you fail to prove where your raw materials are coming from, whether the labels are consistent with the contents of the raw materials you buy, then yeah, then there's a huge suspicion directly already whether you put safe products on the market. So the main focus will be, the first focus will be if to see whether all the documents are correct. If they do a check in the supply chain, yeah, definitely.
Yeah, and I mean, a small practice by the smallest farmer or stakeholder would ruin everything. A small wrong practice, if we can say.
But there,
So,
but then again, this risk assessment is very important, or risk-based. So as a competent authority, it's very essential to find out where the biggest risk is. And indeed, if it's the small scale operator, if they pose a big threat, then the focus of your inspection should be on that group. But then if it's a large number, you have to come up with smart ways to control that, definitely. Yeah. We're going to talk about the inspection part later in another session. Yeah. Thank you, Abir. Keria? Keria, do you want to say anything? Your mic is open. Then there are a few things in the chat, if they can be translated. Sami, Nadia, Fauzia wrote something. Yeah. Okay. Okay. Yeah, very good question. In the Netherlands, it's a food supplements. It's considered as food if it's sold at pharmacies. That's a very good question. Yeah, I cannot answer. It's a very good question, though. I would not expect food supplements to be sold at a pharmacy, but I'm not sure. So thinking out loud, if they would sell food supplements, it's regarded food, so they have to be registered at the authorities as a retail or an outlet where they sell food, and then they are under supervision of the Food Safety Authority, apart from the pharmaceutical controls. That's a different organization. I need to check that actually. So in principle, if they sell food supplements, it's regarded as food. It's under control of the Food Safety Authority. So they will have several inspections by both the pharmaceutical inspection and the food safety inspection. Okay, then let's continue. So I told you a little bit about this multi-annual control plan. This is a requirement of the EU to be more transparent per member state about planning, about priorities, about capacities applied to the different areas. So they have to also express how they are going to do these inspections on a multi-annual basis. So how many people are going to be involved? What is the budget? What are the facilities? So that will give some more confidence for the European Commission on how serious the member state is doing these controls. And then the European Commission is going to compare the member states, how much money they spend, if they're in line with the priorities. And then the member states also have to report every year on the results of this multi-annual plan, on whether they have achieved their indicators on an annual basis. So that's how this multi-annual control plan works in reality. Let's have a look at the well, again, this Office of Risk Assessment is a separate entity in the organization of the Dutch Food Safety Authority. They also are protected by a law defining how this independent risk assessment should take place. And this law also tells us how the work is being monitored. And it allows this bureau to publish independently their results. I'm going to show you the website of the Bureau of Risk Assessment and Research, and it shows you a list of advices that they have made up until this year. It also shows you what are the procedures and the methods they use to support their advice. And it also tells you the council that is overseeing the activities of the bureau, a code of practice, and a reference to the law and the official tasks. And if you look at the advices, so what does the bureau produce in a year? I'll show you the results of 2025. Because it's part of the Food Safety Authority scope, it also covers like invasive species. There was one that I wanted to show you. For example, this one, it gave an advice on the risk of pathogenic E. coli in semi-cured raw milk cheese. So then it will make an estimation, like with the TTX, on what would be an acceptable limit, what are the management control measures to be advised to be performed by the competent authority. And it also shows you the response of the management of the Dutch Food Safety Authority on this advice. So to contribute to the transparency of this advice and the response, they show this information on the website. Fazia had commented, can it be translated, please? Okay, yeah. Yeah, the area of food supplements is a very contested area because it may claim health effects which are not there. In the Netherlands, doctors will not advise or will not prescribe food supplements because they're not covered by the health care system. Only what we would call conventional medication with a proven effect based on scientific tests are available and are financially compensated or partially compensated by your insurance. So food supplements are not covered by the insurance. However, doctors may advise you if you have digestive problems, then, and that is proven, some food supplements may have a positive effect. In general, as far as I know, and this is in general, food supplements for healthy people is not well, does not provide any improvement. This is very in general terms, but if people have digestive problems, some food supplements may have a positive effect, which, well, a proven positive effect. But let's not go into that debate. But I want to make clear that doctors in the Netherlands will not prescribe food supplements as a substitution for conventional medication. That's up to the consumer to decide whether they want to buy that themselves, yes or no. But it's not prescribed by general practitioners in the Netherlands. Because it's not covered by the health insurance and it's not supported by evidence from scientific studies in general. Okay, let's go back to how this risk assessment is taking place. I told you about the specific law on the independent risk assessment. It's not just the Bureau who does the work. They work closely together with the main suppliers, the Institute of Public Health and Wageningen University and Research, particularly the Wageningen Food Safety Research Institute. And then they collaborate on a contract basis with universities if they want to have expert consultations or do additional tests. They can work together with different universities in the Netherlands. Then about the incident and crisis management. This is important because we are going to do an exercise on this later on in this course. It's of course important to also be prepared when incidents take place. We mentioned a few already, and we've learned already that it's important to be prepared when a incident or crisis will emerge. And be prepared means being able to ask the right questions as a competent authority in what needs to be done, what information is missing, and how to communicate with the public and other stakeholders. So a few things that I want to share with you is this classification of signals that may come into the organization, and that would lead to different phases of a crisis, because if you're a higher level of the crisis may require more resources and more efforts to communicate with the public. So it's very important to have this categorization system that helps to make your response more effective. Basically, there are several phases from 1 to 5. The last one, adjustment, is actually after the crisis, when lessons learned should help or should feed into changing of policies or legislation or rearrangement of competences and responsibilities of organizations after a crisis. And the first 4 stages go from like a routine incident, just a exceedance in one situation, to a serious crisis. So let's have a look at the different phases. Phase 1 could be described as there are some indications but not enough facts to make a good judgment. There's no immediate danger to public health or animal health, so no injuries or no casualties. For example, it could be a criminal offense that took place too long ago, or it may lead to a possible criminal offense in the future. So see, they also include fraud in this crisis management structure. Then phase 2, when you would regard something as an incident, typically could be something with an international aspect. So food sold in another country or raw materials coming from another country, leading to a local health problem, like perhaps just in one town or with one company, but with some very serious disease symptoms. And then phase 3, a serious incident where there's an acute threat to health, more than one person affected or died from that incident. Perhaps there are vulnerable population groups involved, or there are new threats for which there is no current response or a current policy to deal with it. And all notifiable animal diseases are included in a serious incident. So typically, if you would think about Salmonella, Listeria, or Salmonella particularly, it's classified as a notifiable disease, then it very quickly would escalate to a serious incident. And then crisis level, where there's a larger number of fatalities due to the consumption of food. There will be major financial or material consequences, so many other companies affected, recalls, people refusing to buy food, etc., and major conflict of interest would be involved. So this classification might help to formulate the right responses. We're going to practice with this in an exercise later on. Then this multi-annual national control plan explained about that. So this is a legal requirement by the EU that every member state has to produce such plan. Then something about monitoring and inspection. The general food law says that it has to be built on risk-based to make the inspections more effective towards dealing with outbreaks of food diseases. Ibrahim, go ahead.
الفرق بين الثلاثة وأربعة اللي هو السيريس والكرايزز الأزمة، هو حالات الوفاة، يعني إذا الكرايزز أو تعتبر إنه في هناك حالات وفاة.
Yeah. Yeah, well, it's a determining factor, but not exclusive. So it would be a combination. Yes, if suddenly a case develops from like 2 fatalities to 20 spread across the country, then that is a clear indicator that there's more happening. So then they're preparing for raising it to a crisis. Once they found out that there are several fatalities, even more than 20 across the country, and it includes major financial consequences, like a blanket recall, people refusing to buy certain food, then that is the decision. Then the decision will be made to raise it to a crisis. But this is like in a way, it helps to define these different phases, but it's also difficult to make very clear distinctions between the different phases. But the most important thing to note, of course, also is that an incident may be raised to the next level because you will have more information is coming to further characterize the incident, or the incident will grow into a crisis because of the number of people affected. Yeah. Mastan?
Yes, thank you. We will have more examples later.
Yes.
We will...
Yeah.
Okay, perfect.
Yeah.
Thank you.
Yeah, it's very difficult to explain how it works just from from theory. And I think if you would apply this in your country, perhaps you have it already, it will be very country specific, I think. And it may be also depending on what type of crisis it is. Is it an animal disease crisis? Is it a human a disease crisis? So there will be different aspects to it. All right. Mari, one of the challenges Bureau faces is indirect pressure from ministries or the media, especially in sensitive cases. So how does it deal with these entities? That's a very good question. In general, yeah, what's to say about it? How this works in detail, we should have a look at the rules, the law, how it's being guaranteed. There are, I don't know the exact details of the law, but there are principles to ensure that the Bureau has the freedom to report. If there is pressure, there's always, and that's part of the Dutch government, a bureau, a separate entity where public servants can report to anonymously. But because this bureau is identified so clearly as an independent agency, also in the professional environment, if they would call out like, hey, we are being pressured, then that will be taken up in the public discourse and the public media. But yeah, there are topics that may not be addressed, but I cannot give you, I don't know of any example yet. If you want to know more, we need to look into how it works effectively. But in principle, there are some rules. There are the separate entity within the government to report pressure anonymously. And that has led to, not in the food safety area, but in many other areas, to public inquiries and to follow up these type of pressures. Yeah, Ibrahim, go ahead.
في المراحل الأربعة في كل مرحلة من المراحل بلزم أو نعمل له risk assessment.
Very good question. I think this risk assessment would be active in any part of the phase. So imagine that if there is a serious incident, then there will be a team appointed which includes risk managers, but also risk assessors, to separately identify and collect the data that will tell what the current situation is and whether it has to be escalated to the next level. So I would say from any level, well, from the level of phase 2, phase 3, perhaps, risk assessment will be included to do further investigation. So what is the source of the hazard, the risk, and is there any scientific evidence to make adjustments to the current control measures? So from phase 2 to 4, definitely there is risk assessment will be involved. Okay, then let's move on. A very important aspect of this risk-based approach is what the Dutch food safety has been doing in the past 2015 to 10 years already, is doing chain-wide assessments for the various sectors or chains that are relevant for the Dutch food industry. So, for example, for the red meat supply chain, but also for poultry, for eggs, for cheese, they've done a chain analysis, which means that at every stage in the chain, they looked at the emerging hazards and whether that would be reason to intensify data collection or monitoring or enforcement. So, for example, is there an example here? Yeah. I hope this will help. So here's an example what they did in the dairy industry. It's a bit difficult. Yeah, let's look at it. So they looked at the whole supply chain from farm animals, so milking cows, to the final consumer. What hazards are available, are present, and this is looking only at microbiological hazards. So they identified Listeria and Staphylococcus aureus as the main cause of disease through the consumption of dairy products. They assessed the flow of the milk. So they saw that 96% of the milk that is collected at farm level is going through the dairy industry, and 4% is going through the artisanal small-scale sales, and they sell actually often raw milk. It's allowed to sell raw milk at farms. It has to be clearly communicated at farm level. And then they assess to which extent certain hazards are present and whether there's a chance of recontamination. And of course, in milk processing, there might be different microbiological hazards. So through this analysis, it shows that depending on which stage in the supply chain, which microbiological hazards needs to be monitored, but also what companies need to assess when they buy milk from the primary sector. So such a study is very useful at public level, so everybody can learn what is the most important hazard in the supply chain. But also companies, when they're doing business with each other, they can use this data, these reports, to prioritize and to include certain food safety hazards in their purchasing requirements, for example, but also in their monitoring and verification processes. So it helps to focus on national level on their monitoring and sampling on the risks instead of doing blanket analysis and not finding any relevant food safety hazard. These studies are reviewed every other 10 years, more or less, or more often if there's an indication that changes are happening more rapidly. So in general, you could see this as fairly adequate and up-to-date lists of hazards that can be present in certain supply chains. Some of these studies are translated into English, or at least the summaries. So this one on the red meat you can find also on the website. I will copy this one for you so you can have a chance to have a look at it, what it actually means. And to give you an example for the red meat, so what were the conclusions? If you look at the red meat and food safety, I hope you can read this. If you look at the red meat, so from the live animal up until the processed food based on red meat, it says that the food safety risks associated with the production and consumption of red meat currently stem almost exclusively from pathogenic microorganisms. However, the health effects involve nearly always mild temporary forms of illnesses. There are hardly any fatal outcomes. This is very useful information to classify the severity of food safety hazards, which is important both for companies but also for the Food Safety Authority to prioritize their inspections. It tells you a little bit about what food safety hazards are present or may be present, how it should be controlled, and then still in terms of priorities, unhygienic procedures can result in bacteria and viruses infecting meat and meat products during slaughter and in all subsequent stages of the supply chain. So it is recommended to improve abattoir procedures, particularly to prevent fecal contamination and cross-infection. And it says that in general, what they have seen in the Netherlands, neither the storage of meat in chilling and freezing facilities nor the refrigerated transportation of meat leads to any significant increase in risk, provided that hygiene procedures are followed. So it says that currently these hygienic procedures are followed in general, so there is a very low level of risk from the transportation of red meat. Of course, if these procedures are not followed, there might be a big risk. So this is for the relevant for the authorities, that they would only have to have records of the chilling temperatures, transportation time, etc., which is much easier than doing physical inspections. So based on this information, there will be no priority on doing physical checks in transport as such, but they're going to focus much more or even stronger on the processes at the abattoirs and cutting plants. Other findings are that chemical and physical food safety risks in the red meat are very marginal. But they stress there should be no relaxation of the existing monitoring, inspection, intervention processes. And that's the paradox, of course. If you have a proper inspection, an effective inspection and monitoring process, then of course the incidences will be very low. But it doesn't mean that you don't have to do these inspections. Otherwise, yeah, governments may cut budgets for these activities and then problems will rise again. So this is about the supply chain analysis. There are others for eggs, etc. So yeah, this is, I think, I want to share about these activities. Are there any questions about this presentation? So on the very brief introduction on crisis management and on doing investigations in the supply chain as a basis for setting priorities and defining your monitoring and inspection program. Ibrahim, go ahead.
في موضوع اللي هو الريسك، في حال الاكتشاف عندنا اللي هو مشاكل او خطر في منتجات اللي هو الحليب. واحنا حكينا انه جزء 96% من منتجات اللي هو الحليب بتروح لصناعه اللي هو الالبان، واكتشفنا انه في صناعه اللي هو الالبان عندنا اللي هو مشكله. جزء من هذا الحليب في المزرعه اصلا بيروح للابقار اللي هو العجول، للابقار اللي هو الذكور، وهي بتروح للحوم الحمراء. يعني اللي هو ال 4% هو او جزء من هذا الحليب هو اصلا بيروح باتجاه تغذيه اللي هو العجول. هذه اللي هو المخاطر اللي بيتم الاكتشافها في المنتج اللي هو الغذائي اللي هو الحليب. في حال اللي هو اتضح انه هاي مشكله وخطيره، هل يعود ايضا بالمتابعه لهذه اللي هو العجول التسمين او عجول اللي هو اللحوم؟
So the question is whether, because part of the milk is being used for rearing young cows, you mean, and whether that poses a risk?
الترجمة لو سمحت والله.
Yeah. Yeah, so that would be in this part of the analysis on the left-hand side. Let me see if that was included here. It doesn't mention it explicitly, but of course, if the milk is contaminated and it will be used as feed, to feed the young ones, then it should be highlighted here. So that's the way to address that issue also, right? To recognize, but also to control it. Yeah. But yeah, it could be a risk, but then it has to be addressed in that first part, of course. Abassam?
اوكي، يعطيكم العافية. أنا كان فاصل النت، بس اللي فهمت سؤال أخونا إبراهيم بالنسبة للخطر اللي بينتقل من حليب للعجول. يعني إذا كان الحليب حسب نوع الملوث، هل هو بكتيري أو هو مثلا مضادات حيوية أو حتى فيروسي. إذا كانت أمراض فيروسية ممكن تنتقل من الحليب للعجل الصغير. إذا كان مضادات حيوية كمان ممكن تعمل أنتي ميكروبيال ريزيستنس عند العجل الصغير كذلك. لكن بعض الأمراض البكتيرية لا تنتقل. بعضها مثلا البروسيلا ممكن انتقالها. هو حسب الملوث وحسب النوع، هل هو كيميائي، هو بكتيري، هو فيروسي. لكن بشكل عام الأمراض الفيروسية هي الأكثر انتقالا من الأم، من حليب الأم للعجل الرضيع. وإذا كانت المضادات الحيوية تركيزها عالي في الحليب بتنتقل للعجول الصغيرة، ما بيكون تأثيرها مباشر على صحة العجل، ولكن ممكن تعمل عنده أنتي ميكروبيال ريزيستنس.
هي اخ بسام، هاي العجول لما بدها تروح للذبح يعني كلحوم، بدها أنا كمستهلك
لا هسه
بدي
العجل
أكلها
اللي
كمستهلك.
بيرضع مش راح ينذبح، بده ست
لا
اشهر
لا،
لحتى
يعني ما هو
ينذبح.
إذا كانت، إذا بحكي على أمراض وممكن له تكون له موجودة يعني في فترة اللي هو الحليب الرضاعة، وإنه هذا ممكن يستمر هذه اللي هو الأمراض مع هذه اللي هو العجول لحين اللي هو الذبح.
لا ما بتستمر، خاصة إذا كانت أمراض فيروسية ممكن تأثر على نوعية اللحم وعلى العجل ويموت قبل ما يوصل لمرحلة الذبح. إذا كانت أمراض بكتيرية هي قليل الأمراض اللي بتنتقل من العجل إلى البني آدم. لكن الخوف بس من الأنتي ميكروبيال ريزيستنس اللي هي الأنتي بايوتكس بس. هيك حال.
تمام، شكرا.
Okay. Yeah. Thank you. Masan?
Thank you. I have a question. Does uh, cholera, for example, it's a food safety problem, or it's not considered as a foodborne problem?
That's a good question. Let me refresh my memory, because there is a bacteria associated to cholera. That's
Yes.
Vibrio cholera, but that's another strain as well, right?
Yes, and usually it's in the water, in polluted water, but after that, sometimes it's transit to the, for the vegetables and the herbs, etc. I'm asking this question because multiple times in Iraq, we had a breakdown of cholera, and it's affected a lot of people in specific cities. So I'm asking if it's considered as food safety, or it's only considered with the health ministry, because usually the WHO are working with that, okay? So I don't know if it's like in food safety, maybe we consider
Yeah.
it an awareness.
Yeah. Well, as I just showed you here, the WHO, just a web page about cholera. So it is caused by Vibrio cholera, either so through food or water, and I think mostly contaminated water is the most important one. But again, if you wash your food with the contaminated water, food will be the carrier. And as long as this Vibrio will survive on the food, it's a foodborne illness. So it depends on where it's coming from, but in general, it's a foodborne / waterborne illness. Yeah.
Okay, thank you.
Yeah. Abir, go ahead.
I was gonna answer Wasan on this
Oh.
because I was a member in the cholera committee, which
Ah.
contains people from WHO, representatives from WHO, FAO, Ministry of Agriculture, Ministry of Public Health, UNICEF, Ministry of Water Resources, Ministry of Energy, because we are all involved. Once it goes into the water, it can go everywhere.
Yeah.
And this was really a very big problem. Thank God it didn't go to the vegetables here in Lebanon, and it was controlled, but it took time because it was in the refugee camps, and this was really very hard to solve. So yes, it is considered as a food safety problem because it can enter the food chain.
Yeah. Thank you, Abir. Thanks. Bassam?
عذرا بس بالنسبة للكوليرا، في عندنا احنا في منظمة الصحة العالمية الحيوانية الOIE، في عندها النوتيفايبل ديزيز اللي هي بتنتقل مباشرة من الحيوان للإنسان. فالكوليرا هي مش من ضمن الأمراض المسجلة اللي ممكن تنتقل من الحيوان للإنسان، خاصة إنه إذا لحوم الحيوان طهيت بتقضي على أي تلوث موجود فيها. في بعض الأمراض المسجلة عالميا يعني ممكن تنتقل مباشرة، مثل الحمى المالطية، أو مثلا حتى إنفلونزا الطيور ممكن دارج، لكن الكوليرا أعتقد أكثر عن طريق المياه.
Yeah. I suppose Vibrio cholera is a very heat-sensitive bacterium.
But don't forget, we eat raw vegetables.
Yeah.
Our culture, we
Yes,
eat
of
raw
course.
vegetables.
Yeah.
So
Well, heat treatment is not the
parsley,
only
lettuce,
one.
etc. If it was watered with this infected cholera infected water, it will go directly to the leaves of the vegetable, and we eat raw vegetable. This is a culture. So it might just go into the human food safety circle. Yeah.
Yeah. Okay, thank you. Then let's take a break until 10:20 our time, so 10 minutes. And we're going to continue with other official controls and introduction to the HACCP, I suppose, right? A little bit. Okay, thanks.
Excuse me, Camille, did you start the session? Because there is no voice.
Thanks. I'm sorry about this. I started already. Then I'm going to start again. Thank you for mentioning it. So we're going to talk about the requirements for food business operators. I hope you can hear me right now, right?
Yes, clear. Thank you.
Thanks. Requirements of food business operators on food hygiene. And we're going to talk about the basic requirements, which we would call the prerequisite program, and a method that deals with significant or specific hazards in a food business, the hazard analysis and control point method. And we're going to look at it through the lens of a inspector. So we'll have some real life situations where we're going to ask you to look at what you would do if you were a inspector. So what are these requirements for food business operators? General hygiene requirements that are reflected in 852, Annex 1 and 2. So there are specific requirements for every different sector. For food of animal origin, there are additional hygiene requirements, which are laid down in 853. And then this is the rule that says that companies have to apply HACCP in their practice. And it applies in principle to any food business operator manufacturing food. So not the primary industry, but anyone who is producing food based on raw materials. And then there are some horizontal regulations relating to microbiological hazards and relating to labeling. These are, in short, the most important requirements for food business operators in the EU. All these regulations are based on the Codex General Principles of Food Hygiene, which explains the prerequisite program and the HACCP approach. So wherever you would do business with companies in another country, if they are member of the WTO and support the United Nations organizations of Codex, so the WHO and FAO, they should adhere themselves to this Codex principles of food hygiene. Nothing more and nothing less. Of course, the interpretation or the translation of these general principles may be slightly different, and we'll explain that how that works for the European Union. Of course, you might imagine that all these rules there are smallholder manufacturers which will not know all details or are unable to kind of understand all these requirements. So there are flexibilities in the EU legislation for smallholder companies, but also in terms of general requirements. And you would see that, for example, in how hygiene objectives are defined. So they're rather defined as objectives, so what you should achieve instead of what you should have. For example, if you talk about walls, it doesn't say walls should be covered with smooth tiles up to a height of 2 meters. No, it says your construction should permit adequate cleaning and disinfection, suitable for the product or process that you are performing. So these terms are rather vague, so you have to, as an FBO, be able to give reason why you have organized your facility as such. So you should either based on literature or based on common practice explain to the inspector whether these requirements, how you have met these requirements. And of course, if you are baking bread, the requirements are different than making a fresh pasta salad with chicken meat, for example. Then the requirements, your facility should be quite different. But only when there is a high risk, even for smallholders, there will be very strict requirements. So in terms of cross-contamination, managing the cold chain, or maintaining the hygiene in a slaughterhouse, then those requirements are very strict. Although there's no other way than doing it just in one way. Also, impact of producing unsafe foods can be included in how criteria are managed, or how food is sampled, for example. So if you have a smaller client base or a smaller turnover, then the number of samples or the frequency of sampling will be lower or can be lower than for larger companies. And there is the opportunity to use generic hygiene plans or hygiene codes, but also generic hazard plans, which have been established for specific processes which are identical amongst a number of smallholders. You can imagine if you go to a butcher shop or a cheese shop, amongst all those shops, practices are fairly similar. And for that purpose, they have described a code of good practice and national guide, adopted or approved by the competent authority, and also registered at EU level so that everyone can have access to it. Sometimes you have to pay for it though. And that covers actually all requirements like these here found on the top of this page. So this is a simplified kind of a workbook for food business operators. And if they stick to the workbook, which means that the type of products have to match the description of the product in that workbook, then you are safe to comply with the EU regulations. Then if you look at official controls, well, that's what we're gonna practice with. we can have a look at the code at the codex now and to see what actually is required. And let me show you this, the most important aspects. This is not going to work. Why not? Open with Ibrahim. Miwal, go ahead.
صغار المنتجين بتم تحديدهم حسب عدد العاملين أو مساحات المزارع أو الشركات أو يعني كمية الإنتاج. كيف بيتم تحديد يعني هذه العبارة في موضوع صغار المنتجين؟
It's a very good question. Let me show you.
Camille, there's no voice. We can hear nothing.
Oh, wait. Do you hear me?
Now, yes.
Okay, yeah. So the question was, how do you define smallholders? Very good question. What you would see, I'm going to show you the Dutch, and this is relatively new. This is the interpretation of the Dutch Food Safety Authority of the microbiological criteria, so the EU legal requirements. And it shows you, for example, whether you are a smallholder. Where was this table? Here. As far as I know, there's no clear definition. So when you would fall under smallholder or larger company. But depending on criteria, it tells you whether you would fall into this category. And yeah, let's look at this part first. So here you will find a table that tells you, depending on the amount of food in this category is meat products you produce every week in kilograms per week, in which category you would fall. So less than 500 kilograms, then the sampling frequency is once per 6 months. If you are a larger company, between 500 and 4,500 kilograms, it's 1 per 2 months. And if it's larger, then you have to strictly follow the requirements in the regulation on microbiological criteria. Also, the number of samples will be higher in that case. So this is how the Dutch Food Safety Authority interprets the size of the company with regards to sampling frequency.
Excuse me.
Yeah, go ahead.
So here they are depending on the kilograms per week, but there is other factors. For example, the high risk, high risk food. Okay, like from the animal source. I think there will be more priority for them or more samples for them, right?
Yeah.
Or ready to eat items.
Yep. I need to check the details of the 2073. We could do it right away. Let me see if I manage to get it right out of it. Oh, wait. Yeah. Oh, it's 25. I'm sorry. No, let me get back to that in a minute. So I will answer that question later because this is not very concise. I'll get back to that question in a minute. So the distinction between smaller, honestly, yeah, we base that on interpretation on the different criteria. Let me get back to the prerequisite program as formulated in Codex.
Camille, if I may say something.
Yeah, go ahead, Abir.
Yes, usually this is the government's role to set up a criteria for what to decide is a smallholder or not, according to the number, to the census of, let's say, if we're talking poultry. According to the poultry census, the distribution within the areas, and then we decide that these are considered as big companies, these are considered as medium companies, and these are considered as smallholders. Usually, يعني below for us, below 20,000 is a smallholder because we do have other places where we have 200,000 or more, sometimes 1 million. So it's the government according to their census, the distribution, the spreading of the farms, the sector itself, the importance of the sector itself. يعني it's something that the government decides.
Yeah, thank you. Yeah, I will check again with what's. Yeah, I was just checking also the internet. There is no specific definition whether it's a small, what is considered as a smallholder, indeed. And I would happy to follow Abir's explanation that it's based on national level, as I tried to explain in the Dutch situation. So I think that's different compared to in the US because I think there are more. Yeah, there are some categories which are exempt from the general approach like this. But yeah, let's talk about the EU context anyway. Once again, I want to get back to this prerequisite program. I wanted to use the Codex Alimentarius to show what it entails and what it includes. Basically, there's one chapter which shows you the requirements. No, let me use the presentation. It's easier here. Yeah, so in principle, if you look at EU legislation following the Codex Alimentarius, it consists of this prerequisite program, which covers requirements with regards to staff, so personal hygiene, the hygiene of food, so proper storage, packaging of the raw materials, as well as the final product, requirements with regards to the building, adequate routing, adequate ceilings, prevention from pests like rodents, adequate equipment in terms of it should be able to be cleaned properly, suitable for the job, for the process, etc., and training of people so that they are fully aware of the risks that are relevant for that part of the work they are doing. So this is what we would call the foundation, which is laid down in 178 and 852 and 853. And then on top of that, the requirement for HACCP covering specific food safety hazards for your process. So again, these are the most important requirements if you look at premises. So that would include construction equipment, waste control, cleaning and sanitation, pest control, provision of water, etc. Product requirements are you should have control over your suppliers. So you should know your supplier. Perhaps you should have a supplier approval system that you buy only from known suppliers. You should know what you purchase, and that should link with the proper documents in terms of certificate of analysis, etc. Origin, the presence of allergens, and then related to personal hygiene and adequate training. Then let's go to do a exercise, and for that purpose I'm gonna go to the next unit. No, this is not the one. Let's go back. Meanwhile, Madi has a question. Are inspections carried out solely by specialists from the Dutch Food and Consumer Product Authority, or are they conducted jointly with quality, trade, security, and veterinary experts? It's for food manufacturing, it's the Dutch Food Safety and Consumer Product Safety Authority only, or this COKZ, which does it for dairy products and eggs. The inspections are normally conducted just for one topic, so either on hygiene or on HACCP. And inspections on animal welfare, on fraud, etc., is done by in separate audits or inspections. There are, as far as I know, there are no combined audits or inspections, unless there is a suspicion that a company, at particular companies who had several warnings, or there is a suspicion that they are engaged in fraud, then there might be a combined inspection, unannounced, where staff from the tax department, staff from the the Food Safety Authority, different departments may come just as a surprise inspection to be able to secure all the information that they need for investigation of a serious fraud incident. But in general, all these inspections and audits are done for one topic only. Let's go to that exercise that I promised you. Here it is. So let's just do this by a plenary. I'm not going to use breakouts. I'm going to share you one of our inspectors from the Dutch Food Safety Authority. He will explain a certain situation that he has found during his inspections. And the question for you is is this a non-compliance? What is the non-compliance? So could you tell us what is the legal reference? Is this the general food law? Is this based on the prerequisites? We will discuss that after he has explained the situation. Let's make sure you can watch it properly. Let's go ahead. Oh, wait. I need to activate the audio.
pizza production plants, and you see very, very dirty facilities, and you see that ongoing construction works, the floors, the welding machines, everything is covered in a layer of fat, all dirt and dust. The staff is smoking. Think about the people I told you in the premises. You see a cat. But what says the owner of the company? Sir, this is not a problem because all the pizzas will be baked anyway. So the microbiological problems, it solves itself when you are going to bake the pizzas. So I'm curious about what you think about this. You think that there is a non-compliance situation? If any mail.
Okay. So what do you think? Is this a non-compliance? Can somebody tell me?
It's not a situation anyhow. يعني it's not a kitchen to be used for cooking.
Yeah.
For granted.
And so it's a non-compliant situation. And
For granted.
why is it not suitable?
Because it doesn't apply to the all the regulations that should be done from hygienic point of view, from while working points of view. يعني they are working and cooking while they have people working construction works. They have dirt all over, so hygienically people smoke there, so there are no also regulations for workers. Animals are inside. There's a cat and there's rodents. يعني you have both. And the most important problem is that the owner sees that there's no problem. يعني he's unaware of all the dangerous activities that he's doing within his restaurant.
Yeah. Okay. Clear. Thank you, Abir. Let's see if anybody else has anything to add to it. Ibrahim, go ahead.
أكيد هو عدم الامتثال، لأنه في هاي الحالة عملية الطبخ ممكن أن تقتل جزء من هاي الميكروبات والجراثيم، لكن فإحنا عندنا أيضا له مخاطر العلاقة بالفيزيكال، بالمواد الكيميائية اللي ممكن تكون موجودة في هاي البيتزا. فهو عدم الامتثال، لأنه المخاطر متعددة، ليست فقط هي مرتبطة بما يمكن له القضاء عليه أثناء عملية الخبز أو الطبخ للبيتزا.
Yeah, exactly. Yeah. And therefore you need to comply with the basic hygiene requirements, regardless whether it will be killed by cooking, yes or no. This is just a basic requirement as we explained earlier. Madi, anything to add?
شكرا للجميع. بالنسبة للمثال هذا معناتها أنا أتحدث معناتها على أمثلة في بلدي في تونس. إذا معناتها وجدنا مثل هذه المحلات المفتوحة للعموم أو المصانع هذه وبحجم هذه الإخلالات، هنا المفتش الصحي أو المراقب الصحي سيكون معناتها على حسب تقييم المخاطر والمخالفات التي معناتها وجدها على عين المكان، إما القيام بتنبيه معناتها للسيد المالك معناتها المطعم، أو القيام معناتها بقرارات غلق إذا كانت معناتها حجم هذه المخالفات كبيرة وتشكل خطر حقيقي على صحة المستهلك. ستكون معناتها هناك ضرورة لغلق مثل هذه معناتها المحلات، وكذلك إخضاعه معناتها للتتبعات القانونية والمخالفات. شكرا.
Yeah, exactly. In the EU context or in the Netherlands context, there is enough right to close this company immediately. Yeah, definitely. Camelia. Camelia, do you have anything to add? We can't hear you.
نعم.
Yeah. Yeah.
وصباح الخير. هي ممكن عدم احترام شروط النظافة والنظافة الصحية في وجود الحيوانات ممكن أن تنقل أمراض للأغذية مثل شعر القطط أو مثل التيتانوس مثلا.
Yeah, clear. So indeed, just on the basis of the prerequisites, this is not allowed to produce. Then let's see what. Yeah. So and the intervention would be closing the company. Let's go to the next one. So the applicable legal requirement here is on the prerequisite program. So then the next one, yeah.
Just excuse me, Camille, can you make it full screen, please?
Just a second. Yeah, Vasant, go ahead.
Sorry, can you make it full screen for the video?
Yeah. Let me see if that's going to work. It's a bit complicated because it's embedded here. So does this help?
Yes, perfect. Thank you.
You think that there is a non-compliant situation to another real-life situation? Now it's a little bit different. I'm giving you some pictures too. I want you to have a good look at that. This is the outside of the company. So what you see here is it's a mess, the outside of the company, and you see there the rolling door. There's the entrance of the company, and in the outside it's really filthy with still water, and there were a lot of rodent activity there, big rats, and it's a mess with all materials and everything. But once I came into the company, this is a fish processing plant. Once I came into the company, there was no problem at all. So indoors, everything was clean, no problem, no rodents, all legal requirements were met inside the company. So you think that there is a non-compliance situation in this company referring to the food legislation? What do you think?
Yes, Gabi, I will say that there is a they have not they have.
So anyone, is there a non-compliant situation here? Bassam, go ahead.
نعم، هو عدم امتثال بسبب وجود الفوضى الخارجية والفئران والمياه الراكدة التي ممكن أن تلعب دور في نقل الأمراض عن طريق الحشرات والقوارض اللي ممكن تنتقل لداخل المبنى أو المكان اللي راح يتم فيه تصنيع الغذاء. فبالتالي هو عدم امتثال، ويجب الالتزام بالتنظيف والتأكد من خلو البيئة المحيطة في هذه المنطقة وتكون نظيفة وخالية من أي ملوثات والأمراض، خاصة بسبب وجود الفئران والحشرات، وممكن هذا يؤدي لوجود القطط والكلاب وغيرها، وبالتالي راح يكون يؤثر سلبا على أي منتج يكون موجود.
Okay, well, there are no cats here. This is a different company, but Bassam, what do you think is the what would be your intervention if you were the inspector?
بعطيه مخالفة حتى يعدل الوضع المحيط في البيئة المحيطة في المبنى أو المقر اللي يتم فيه تصنيعه.
Yep. Yep. Okay. Thanks, Adib.
تحياتي كميل، تحياتي للجميع. نعم، هذه إنها حالة عدم امتثال الواضحة أمام الجميع، ولكن في هناك نقطة بأنه هاي المنشأة كيف بتم ترخيصها من قبل الجهات المختصة، لأنه بتقديري الموقع زائد المنشأة أثناء إنتاجها يجب أن تحصل على ترخيص، فهاي نقطة مهمة. ثانيا، هناك في خطر ليس فقط على صحة المنتج وعلى المنتج، وإنما في خطر واضح من خلال انتقال الأمراض المشتركة ما بين الإنسان والحيوان. وإذا ما تحدثنا عن الإجراءات القانونية، يجب أن يكون تدخل من قبل الجهات الرقابية. أولا إيقاف عمل المنشأة. ثانيا هل انه تم تسويق منتج صدر من هذه المنشأة لأي حد وصلت خطورته، وإجراء المخالفات بحق المنشأة لكونه عدم التزامه بمبادئ السلامة الغذائية. وشكرا.
Okay. Adib, I hope you remembered what the inspector said and also what you can read. Inside the premise, everything is fine. Everything is clean, and the FBO complies with all the legal requirements. So only outside it's a mess. But on the inside, everything seems to be fine. And no evidence that the mess outside has an impact on the performance inside. If you know that, what do you think?
لكن
What should the
كميل،
fine be then?
صحيح كميل، لكن
Yeah.
هل هذه لا تعتبر CCB؟ يعني بأنه هناك خطر واضح. أعتقد المنشأة سواء في الداخل أو الخارج، حتى لو كانت العملية العكس، بأنه في الداخل الأمور محددة وفي الخارج العكس، لكن هناك خطر واضح لربما خلال السلسلة، هي جزء من سلسلة التوريد، يعني بمعنى هي حالة مشتركة، وبالتالي تعتبر CCB حتى لو كانت الفوضى فقط في مكان محدد وعدم وجودها في مكان آخر. وربما أنك أنت تصحح وجهة نظري. شكرا.
Well, yeah, this is the tricky situation, of course, because on the inside everything is fine, on the outside it's a mess. Apparently, they managed to keep the mess outside. That's what you can conclude from this situation. And in the Netherlands, the situation is that.
ليبيا هاي ندرسوها هن. طيب.
Just a second.
Sorry, I left my mic on. I'm working.
Okay. Yeah.
I need to answer something.
Yeah. So, in principle, and this is what our inspector also explains to us. Let me continue the movie.
And not are some rules
Camille,
that
can I
companies
say
not
something
following,
before you continue?
they are not set.
Yeah, go ahead.
Yes, there's something missing here. What about the entrance between inside and out? They didn't mention it.
Yeah,
Okay.
yeah.
So I would close it until they clean outside. But are there any biosecurity measures? How come this chaos doesn't enter? There's an information which is missing here. And do they have very high monitoring for the entrance area?
Yeah,
Also,
lots of
I
questions.
repeat,
So,
for
yeah.
me, if I'm an inspector, I would close it until they clean outside, because for me, the surroundings are very important.
Yeah.
This is how I start my scanning.
Okay, thanks, Javier. Let's have a look what our inspector
كميل،
says about it.
ممكن أضيف ملاحظة؟
Yeah, go ahead.
Yeah.
إبراهيم.
هلا موضوع البري ريكوست بروجرام محدد وفي له متطلبات يجب له الالتزام فيها، لكن لو مدى له الالتزام بهذه له المتطلبات ممكن له يحدده المفتش. لكن إذا أمكن صاحب المنشأة تقديم ريسك أسسمنت، اللي هو تقييم بأنه هذه الحالة الخارجية اللي موجودة فيها اللي هو الشركة لا يمكن أن تؤثر على المنتج في داخل الشركة. فهان ممكن يكون في لا عدم اعتبارها حالة عدم مطابقة. إذا لازم يكون في عندي هو بده يثبت من خلال الريسك اسسمنت انه ما في عندنا هذه الحالة الموجودة لا يمكن ان يعني تؤثر على المنتج في الداخل.
Yeah, that's a very good approach. In this case, the situation is quite simple. If you look at the EU legislation on the prerequisites, so the premises, hygiene conditions, it doesn't say that much about the outside of the premises, weirdly enough. So this is under the rule of the municipality. So in this case, the inspector, of course, he's concerned. But at the same time, on the inside, it looks pretty, he says it complies with all the legal requirements. So in this case, what he did, although it's not part of the EU legislation, he would contact the environmental officer of the municipality because this is under the rule of the municipality and not of the food safety legislation. This is a bit of a tricky one because this is how it's organized in the Netherlands. But clearly, the EU legislation said that on the outside, there are not so much requirements as such. So the inspector cannot enforce based on the Good Hygiene Law 853 or the General Food Law, but he has to defer this to the local municipality. That was the situation. Let's see if he explains it in more detail.
In the legislation about food. So you have to do something about this because sooner or later it's going to referring to the food legislation. What do you think?
Yes, Gabby, I will say that there is they have not they are not in compliance with the environmental standard here because they have left everything open, like the water, stagnant water there. There is the chance of pests like mosquito and other stuff. So they have not complied with environmental standard here.
Okay, that's very interesting. What you say is all true. It's a huge risk. This is a really, really dangerous situation. But I'm telling you, according to the EU legislation on food, there is not a non-compliant situation because this is the outside of the company. Of course, you should do something about that. But the regulation is about the premises in the company, not outside the company. So there are some rules that the company is not following, but they are not set in the legislation about food. So you have to do something about this because sooner or later it's going to go wrong. That you are completely right. The rodents will not stay outside because inside the company they have much better food than outside. So they are going to try to get into the company, and also people are going to walk through these areas, these filthy areas, into the company. You have to do something about that. But what can you do? Because if you don't have the instruments in the food regulation to intervene, what would be your intervention? What do you think?
Sorry, Gabby.
Yeah.
So,
for instance, by a certified.
What about the possible entrance of?
But food safety is not regulated that the outside of the buildings have to be clean. You don't have to confuse this with rules set, for instance, by a certifying company. If you are going for a BRC or IFS or FSCC certificate, they have rules about the outside of the company, but there's not in the EU legislation. I agree with you. There is a problem.
Okay, so this is the thing here. So there was a bit of a tricky question. And what our inspector is trying to explain is that if the company is certified for a private scheme, then definitely the outside is also a requirement part of the requirements. Okay, for the sake of time, let's continue. I've got another one for you. And it's number 2A.
To another real life situation, now it's a little bit different.
Oh,
I'm
no.
giving.
Sorry. 2B.
But this went on.
This is the same company, but another finding.
In this company, when I thought I was done, I looked better on the outside and I saw this container you see on the picture. It was filled with fish offal. It was really, really, really bad smell. It was completely spoiled with flies and rodents activity because it's the same thing. And it was in the outside of the company. So it was not in the company. And the guys told me, oh yeah, I'm going to sell this to a company who makes pet food from this. So do you think that this would be a non-compliance? Because this container was outside the company.
So any responses? Is this a non-compliance and
But
why? Oh,
this
wait.
went on.
Shoot. Wait, anyone?
Yes.
Bassam.
Okay.
هو أكيد عدم امتثال، لأنه بوجود مكرهة صحية مثل هاي راح تكون بؤرة لانتقال وانتشار الأمراض، لأنه عندنا القوارض والحشرات هي ممكن تلعب دور كبير في نقل الأمراض، خاصة أنه هاي بؤرة غنية بالملوثات والجراثيم اللي ممكن تنتقل عن طريق الحشرات إلى الداخل حتى لو كانت في الخارج. فهي مكرهة صحية وعدم امتثال وبؤرة خطيرة جدا على المنشأة من وجهة نظري.
Yeah, so you say it's a non-compliance because of the microbiological standards, yeah? Then
No.
a beer.
Okay, first of all, this is something has to do with the documents of the waste management. If he's considering them a waste and he's getting them outside in order to sell them later, so this is a waste management. He's doing something that doesn't comply. Second, it's going to be pet food, so it has to be safe. It's not only pets can't eat any kind of food. So here it can collect, not collect parasites, pathogens, etc. By the way they are stored outside, especially that the surrounding is very dirty. So you have two issues to say. The waste management of this company is not practiced well, and the pet food, this is not a good source for pet food.
Yeah, okay, thank you. Then Vasan.
Yes, thank you. Similar to what Abir mentioned, okay, but first thing, they are considered as suppliers, okay? They are considered as suppliers for the other factory that are producing the pet food. So as a raw material or a supplier of the raw materials for this factory, it will be considered non-compliance. This is first. And second, it will affect the welfare of the animals. Thank you.
Yep. That's very clear, thanks. Then Kyria mentioned something in the chat. Can that be translated? Nadia, Sami, can you translate? Oh, maybe my settings are not right. Yeah. So Kyria at 11:10, what's the translation?
She's saying that these are would cause into sick diseases in the animals, so it's uncompliant.
Okay, yeah.
And the same for the others. Everyone is saying the same.
Okay,
The
yeah.
diseases
Okay, clear.
spread.
But Yes, so indeed, it's a non-compliance because of the this is not suitable for consumption, so that's a prerequisite requirement, but also based on the hazard requirements, because significant hazards that can that relate to this as pet food also need to be controlled, and this is not a controlled situation, definitely. Yeah. Okay. Then let's conclude at this stage with these two exercises. On Friday, we're going to have a session on Friday, so not on Thursday. We're going to continue on this topic and look at one more example, but I'm also going to introduce the concept of hazard analysis and critical control points. Let me see if I've activated that already. No. Hey. Okay, it's not working. Anyway, I'm gonna introduce you on the hazard analysis and critical control point. We're going to do an exercise on that. So before we can start that on Friday, I want you to read some background information, which I will give you in the in an email for homework for Friday. So are there any questions at the moment on official controls in the Netherlands, the prerequisite program as it is laid out in the EU legislation? I know I need to follow up on some of the questions that you gave me earlier, so I hope I can answer that on Thursday. Otherwise, put them in the Padlet of our Talent LMS so that we won't forget them. Any questions? Friday, same time, so 9 o'clock in the Netherlands. Nope. Okay. Then I would like to thank you and our interpreters for your contributions today. And I'm looking forward to the session on Friday. Thanks a lot.
Thank you. Hope the homework won't be so big because we are during the workday.
Yeah, there's no session on Thursday, but on Friday. Did you get you did get the program, right? Or yeah, okay. Yeah.
On Friday, can we leave earlier?
Probably we will end earlier, yes. Yeah. Yeah.
Okay, because it's our weekend, that's why.
Oh, yeah.
Okay. Thank you.
Thanks.
Thank you. Have a good day.
Thank you very much.
Where did you send the program, Camille?
The program is on a Talent LMS. So you
okay.
can block
I
zero.
thought it was an email. Okay.
No.